Well, I'm joined now by Hani Baragwanath Hospital's head of pediatrics, Professor Sithembiso Velaphi. He's been researching what's been happening with COVID-19 in children in other countries and joins us via Skype. Good evening, Professor. Thank you very much for your time this evening. I really do appreciate it. You know, a few weeks ago, and in fact for quite a long time, we were told that most children who get the virus, it'll be asymptomatic or mild symptoms, and that one of the saving graces at that point is that children were hardly affected. Is that picture starting to change? And I ask this because I've been reading frightening things about something called multi-system inflammatory syndrome. So just how much more concerned are you as a pediatrician about children in COVID-19 than you were, say, 6 weeks ago?
Yes. I think the number of children who get affected by COVID, the numbers are relatively much less than in adults. Even when they are affected, a number of them are asymptomatic, or they've got mild or moderate to severe disease. So, for example, some studies have shown that up to 30% of children might have no symptoms. And then of those with symptoms, about 90 to 95% will have mild or moderate symptoms. So less than 5% will have severe symptoms to require even ICU. So in children, it's not that severe.
All right, so despite these new studies coming out and some research from doctors in Italy, for example, that sees this sort of inflammatory syndrome cropping up sometimes as a post-viral complication, are you saying it's still nothing to be alarmed about?
Well, one has to be alarmed about it because that is one condition that when they come in very severe, in severe shock. And sounds like or seems like in terms of the other features with like a condition that we call a Kawasaki disease. But those numbers are still relatively few compared to the overall infection in children. Yes, when it happens, it can be quite severe. That is worrying in that sense.
All right, so just talk us through what are the symptoms of this multi-system inflammatory syndrome, and if you can also give us an idea of how rare it is as a sort of a side effect or a post-viral response in children from COVID.
So the symptoms, they can have a fever, they can have a rash, red eyes, and also they can have a swelling, especially of the mucosa. And then with that, the heart can be quite affected and presenting what we call sounds like a toxic shock. So they can be quite severe. I think in terms of the numbers, some countries like UK have reported up to 8 cases. So, but overall, they have seen more than 2,000 patients, children with COVID. So the numbers are there. But in terms of the numbers overall, it's much less compared to the rest of the symptoms. So it usually occurs 2 to 4 weeks after the infection. As a result, some of the children might have negative PCR, but when you look at their antibodies, which usually come up later, they are positive.
And it just shows, I suppose, how little we know about this virus. And we're seeing conditions, as you say, popping up like a month afterwards. Still a very rare occurrence, as you're explaining. Here in South Africa, I think it's 2,200 children have been confirmed to have COVID-19. With this syndrome, was there any indication that these children had comorbidities or pre-existing conditions, or were they perfectly healthy kids who just somehow succumbed to this inflammatory syndrome?
So from the history of what has been published, they don't seem to have many morbid conditions. They come in like any other children, but when you look back, some of them have had contacts with a person with COVID, but they come in later very, very sick.
I think one of the hardest things about this illness is that we're having to embrace what we don't know. So what you've just told me is about a rare condition that seems to hit some children 4 to 6 weeks after they've had the virus and they don't have any underlying conditions. Now, that somewhat goes against everything we've been told up to now, which is children with comorbidities have to be really, really careful. So children who are HIV positive, who have got TB, who perhaps are asthmatic and who have other underlying health conditions should be more cautious. Now, I would imagine that still prevails as advice, but what do parents do with this new information as it comes through? Because we are learning as the scientific community is learning, and it's hard to move risk to one side when you hear something like that.
Yes, so we still have to be worried about children with other comorbidities. So we still have to watch closely those kids when they've got the signs of infection. But this latest infection, the Kawasaki-like kind of syndrome, is not necessarily related to any comorbid condition. It can happen with any child. So I think in terms of the parents, the infection is there and it's going to be with us for some time, and we have to be prepared to live with it. So, but when it happens in children, so for example, NICD gets information from a number of hospitals, more than 240 hospitals, from both the private and the public sector. When you look at those admissions of those people who are admitted to those hospitals, just over 6,000 patients have been admitted as of the 30th, as of the 7th of June. But looking at that number, that's 6,000, only about 247 were children. And if you look at that group of those children who were admitted, only 3 died from that group of hospitals. So what that suggests is that the children can have infection, but when they do have the infection, very few have a severe infection, other than the one that you have mentioned, the Kawasaki-like syndrome, which is, again, is a recent one, which I think we're starting to learn more about it as it presents.
Thank you very much for your information this evening, Professor Sithembiso Velaphi. Thank you very much for joining us. He's Head of Pediatrics at Hani Baragwanath Hospital.